Good afternoon. Today I will be talking to you about a topic which I find very important, assisted suicide. My specific purpose in bringing this topic to your attention is to persuade people that assisted suicide should not be legalized. Suicide is already a major issue being faced in the world today. With the support of others aiding in the idea for someone to kill themselves, the likeliness they will go through with it is now at a higher rate. Think of a situation where a fellow peer lets you know that they are thinking about committing suicide. Usually in a suicide, when a person is serious about killing themselves, they tell you through a text or leave a note behind for after they die. It is very unlikely that people tell you their plans of committing suicide face to face. A face-to-face confession of your plans will convince you to stop and not go through with your plans, because when you tell somebody about committing suicide, they talk you out of it. People talk you out of it because they will miss you, and no decent person wants a death on their conscience knowing that they could have stopped it. In the unlikeliness that you find somebody that will help you go through with suicide, the chances of you going through with it are now at a higher rate. Entitled Physicians Assisted Suicide. Assisted suicide mainly occurs in patients facing chronic diseases. Today I will be using information found through extensive research to persuade you that assisted suicide should not be legalized. I will begin this presentation by explaining what assisted suicide is and why someone will want to commit suicide in that manner. Then move on to the causes and effects of assisted suicide. Lastly, I will give you the reasons why assisted suicide should not be legalized. We will first begin to transition into looking into what assisted suicide is and why someone will want to commit suicide in that manner. Many people suffer from a disease which doctors cannot cure. Instead, doctors end up giving them a medicine which help keep them as stable as possible. These patients go long periods of times thinking that there will never be a cure to make them happy and at peace. Assisted suicide is their way of ending that pain and having that peace. As a patient, you know when you want to pull the plug. You don't only do it for yourself, but you do it for your family as well, so they can move on and stop hurting with you. Assisted suicide is when you decide that your time has come and now need the help of a medical professional to end your life. Next, we will begin to investigate the causes and effects of going through with assisted suicide. In every death, there is a question left behind for the family to answer. What's next? After the passing of the ones that they held close to their hearts, they find themselves lost. It is hard to move on, though the reason for the suicide was not one of the ordinary factors which occur in suicide, such as depression, being bullied, or even a traumatic event which occurred in their life. Deep down, the family members knew that there was no cure and that their time was approaching soon, but never did they expect the unthinkable to happen. For them to be called down to the hospital to find out that their family member or friend is dead, not because the medicine didn't work or it finally gave out on them, but because they went through with suicide and ended their life. It is not always easy to see signs of foul play such as this which occur in hospitals. Following your suicide, there is always that one unwilling to let go, saying you were just fine yesterday when they visited you. They go around thinking that the doctor has not done their best and that the doctor is to blame. It is unlikely they will know what actually happened, that the doctor assisted you in suicide, unless you leave behind a note. But when you finally pass, you leave behind trouble for that person that assisted you in suicide. This trouble is not of the moral kind, but also of the legal kind. In some states, such as Minnesota, the fine will be up to $30,000, and the time in jail will be 15 years. In other states, such as South Carolina, the fine could be all the way up to $100,000 and also up to 15 years. Lastly, I will portray to you in words why assisted suicide should not be legal. The world is changing every day, and with that, there is new advancements in everything, including medicine. There has been extreme improvements in medicine since the dawn of time. One of the biggest advancements in medicine was the ability to do surgery. This helped soldiers fight in war and get back home safely to their families. Because of surgery, doctors have been able to treat things like cancer. An example is brain tumors, something which can take over your brain and grows, making you do questionable things. With diseases such as this, it is possible to come back with a full bill of health if you cut out all the right pieces. You will die if you commit assisted suicide, and the next year or so, there might finally be a cure which could have ailed you. To conclude this speech on whether suicide should be legalized, I believe that ending a life is hard. When you take your life, you leave the people you love in mourning. In certain circumstances, you may not even have proper life insurance. Now you're not only leaving them with your loss, but you're leaving them with a great deal of financial issue to find out how they're going to send you off with a proper burial. In the funeral, people will be coming up to them asking them how you died, and they'll also be left with nothing but the truth to tell them that you killed yourself. That will be very hard on them. Not only is it still going downhill for your family, but it's also going downhill for the doctor, the person who helped you assist in your suicide. They'll be facing lawsuits, jail times, and possible financial issues. With all these possible outcomes of what could happen with assisted suicide, it is clear that the answer is no. Assisted suicide should not be legalized.